A very good evening to all the viewers. I am Dr. Shweta Khadge from the medical team of USV. Welcome you all to today's meeting on novel treatment option for productive cough in children. Cough is one of the most common symptoms that doctors face in the pediatric population. Even with a clear diagnosis, cough can be difficult to control and for the patient can be associated with impaired quality of life. Traditional therapeutic approaches have been in place, but the efficacy and safety have not been evaluated for children. Dry eye relief extract cough syrup with a consistent amount and composition of active ingredients have shown consistently reliable results to deliver productive cough relief. So, to share his insights and clinical experience, I welcome Dr. Sujit Tamboli sir, who is the first practicing pediatrician in Maharashtra to be awarded PhD pediatrics from MUHS, FIAP, awarded as India's top most 25 pediatrician and the most promising doctor in developmental and adolescent pediatrics in India. He is a faculty member in many national and international conferences. Thank you so much, sir, for joining us today. So,
Thank you,
sir,
Dr.
like,
Shah.
yes,
Thank you
yes.
very much.
Yes. So, sir, like I mentioned about, cough being one of the most common symptoms seen in pediatric practice. Can you highlight in which of the conditions does productive cough act as a primary symptom, and how long does productive cough persist for?
Yeah, definitely. Actually, initially, we must know that cough is an important defensive reflex that enhances the clearance of secretion and particles from the airway and protects the lower airways from aspiration of the foreign material. This is very important. That what we think that cough है तो problem है तो actually नहीं, cough is a defensive reflex. That is very important, you must know. And according to 2006 chest cough guidelines, the most common causes were respiratory infection, most likely of viral causes, and followed by exacerbation of underlying diseases such as asthma, COPD, or pneumonia. So, what is productive cough? Productive cough is a cough that results in mucus, phlegm, or blood being expelled from the lungs or upper airways, and it indicates an underlying causes of mucus hypersecretion or impaired mucociliary clearance. And symptoms which include a cough usually resolve in 3 weeks. So sometimes bronchitis can become chronic, and in this case, the daily productive cough can persist up to 3 months. So what you have asked that how much time it will remain. So it can remain from 3 weeks to 3 months also, and it may come back year after year. The mean duration of cough in the published literature is 17.8 days, and cough can be due to virus, other infections, chronic lung disease, or uh, actually stomach acid, which is ascending the esophagus, means gastroesophageal reflux. That can also cause productive cough. Post nasal drip. This is very important that a productive cough can be result of a drainage which down the back of your throat, and it might also cause the constant need to clear your throat. So, however, there is a debate among experts that whether the drainage or lingering virus is the cause for the cough in these cases. But important thing is that when a patient complains that the cough is more in the lying down position, so more in the night. So post-nasal drip is many times likely cause. Tobacco use, either irritation or damage to the lung, can cause productive cough, and upper airway infection or chronic lung disease and viruses also can cause cough, which is productive. So that is very important. So asthma, congenital malformations, or uh, then bacterial infection. So all these can cause cough. Foreign body inhalation, which is again very important cause for the cough. So passive smoking and environmental pollution is also one of the important cause for the cough. So while
Yes.
assessing the cough, actually, I think it is very important that you must assess cough properly with the history and actually the evaluation with the investigation. So that's all I want to say.
So, sir, rightly mentioned by you that cough is a symptom to a disease rather than being being actual disease. So here there are multiple reasons of why a cough can be produced, like how sir mentioned about any foreign body or any disease such as COPD, asthma causing cough, and also that productive cough is with phlegm with mucus it's due to mucociliary hypersecretion, which is very important, should be considered by all the doctors when treating cough. So sir, here I would also like to understand from you that what are the effects on quality of life, since you mentioned about cough being a symptom. So how does it affect the quality of life if it is not treated within time?
Yeah, actually, that is very important, and for that, you must first initially assess history and physical examination, where you should identify what is the duration, quality, trigger, then what is the progress, then is there any neonatal history or family history, environmental exposures, then ENT examination, then actually nutritional status of the child, as well as physical signs. All these are very important regarding the history
Hmm.
and examination. Then actually prevalence assessment and treatment also should be taken into consideration when you are considering acute cough. So the majority of acute cough attacks in children, they are related to viral or post-viral urtia, and they do not require further investigation. Then chronic cough, how it affects the quality of life is very important, that it can interrupt your sleep and leave you feeling exhausted, because if sleep is not proper, then you will feel exhausted in the daytime. Severe cases of chronic cough can cause vomiting, lightheadedness, and even rib fractures. Suppressing a weight cough can lead to buildup of mucus in the air passage of the lung, and this can lead to further complications such as breathing difficulties as well as infection. Then damaged blood vessels, because pressure from the intense cough may cause some of the delicate blood vessels in the eyes, nose, or anus to rupture. So you can get the actually presentation like redness of eyes, uh, so that the delicate blood vessels may have ruptured there, or epistaxis, or anal bleeding also. Then chest pain. So coughing exerts muscles in the chest, and an extended period of the coughing can lead to chest muscles feeling sore and fatigue. So these are the commonest problems which you get if you do not treat cough properly or in time.
So,
Shweta.
yes, sir. So, rightly mentioned by you that chest pain and times that are awoken in the night, the sleep disturbance patterns is something that is troubling. And sir, also that since we've discussed about the cough and assessment and what is the requirement, sir, what are the traditional and newer therapeutic approaches for productive cough?
Yeah, actually, here for the traditional therapeutic approach, we know that antibiotics should be given early to the children with pertussis, or bronchodilators are not effective for acute cough in non-asthmatic children. Antihistaminic and intranasal steroid are beneficial for children with an allergic cough in the pollen season. And antibiotics are generally not effective, or they are not recommended for treating acute cough which is caused by simple head colds. So if you have a productive cough, try the following. That is like actually in a traditional therapeutic approach, what you can try is self-help measures like drink plenty of fluid, which can help to thin the mucus and make it easier to cough up. Take a hot, steamy shower to help break down the mucus or phlegm and make it easier to cough up, and get plenty of rest. So, rest is very important. Drink plenty of fluid, as well as it is very important you can take a hot, steamy shower also. So, that type of traditional therapeutic approach also can be useful for the cough. So actually here we should understand that newer therapeutic approaches are very important, and medicine Prospan. Actually here it is very important that what are the contents, like actually this saponins, which is emulsifying agent, and antioxidant and anti-inflammatory agents are also there, which are very useful. And uh, for the diagnosis of the cough, how you can approach in a newer way is that initially we used to do just X-ray, but now pulmonary function tests are very important to diagnose either it is asthma or chronic bronchitis or bronchiectasis. Then restrictive ventilatory defect, pulmonary fibrosis, sarcoidosis, or corinosis. So all these things are actually we should diagnose. And then broncho provocation testing or bronchial inhalation challenges. So such type of test also will useful to diagnose the productive cough.
Hmm. So, sir, yes, correctly mentioned that there are multiple traditional therapeutic approaches to cough, wherein antibiotics, steroids, and corticosteroids and intranasal steroids can be given to patients,
Yes.
but they come with their own side effects and cannot be considered as safe in children. So, and you also mentioned about the dry ivy leaf extract syrup. So, sir, what are the benefits of the cough syrup, dry ivy leaf extract cough syrup?
Actually, here we should know that specific extract from the leaves of actually this thing. Actually Hydra helix, which is used, and this extract is carefully obtained through a patented extraction process that helps ensure a actually consistent composition of ingredient and showing 5 action. Actually, these actions are very important because mode of action of that IV leaf extract is very important. And one of the active ingredient actually here contributing to the effectiveness of the prospan is alpha A hydrin, and it binds beta to adrenergic receptors and prevents them from being inactivated. As a result, the receptors are no longer internalized and the adrenergic cells remain highly responsive to adrenaline. The adrenaline can work more effectively because with Prospan, the CAMP concentration remains high, whereas it increases without it. And the more beta 2 adrenergic receptors are available on the surface of the cells, and the more adrenergic can bind. Thus, the concentration of CAMP in the cells increases, and in this way, Prospan actually support the widening of the bronchial tube and the liquefaction of the mucus. Therefore, actually, it elevates the symptoms of coughing. So, alpha hydrogen and other ingredients of Prospan also reduce the inflammation. So, patient with cough can breathe deeply again. So here
Yes.
we must remember that ivy leaf is the common name for the leaves plant of Hydra helix. And ivy leaf preparations are obtained as a dry, liquid, and soft extract by putting the plant material in a solvent such as ethanol and to dissolve compound and form a liquid extract. So actually, ivy leaf has been found to contain many compounds, including saponins, which via the nervous system activate cells in the lungs to remove excess mucus. And ivy leaf has also been shown to liquefy thick, sticky mucus in the respiratory tract. So this extract contains tritrypsin saponin, which gives uh, actually secretolytic and antioxidant properties, and they stimulate the cough reflex, irritating the sensory nerves ending in the gastric mucosa, which by way of vagus testicles significantly increases secretion in the respiratory tract. So in this way, actually, ivy leaf extract is effective in the treatment of the productive cough.
Yes, yes. So correctly mentioned by you that the ivy leaf extract cough syrup has alpha hydrin as the chief component, which will act as a mucolytic, broncho secretolytic properties, and also reduce inflammation, which is important components to reduce productive cough. So yes, and sir, here since you mentioned about the mechanism of how ivy leaf extract works, can you also highlight on how it is effective in treatment of productive cough?
Yes, actually there is triple action formula. Means
Hmm,
there is mucolytic action, then
hmm,
bronchospasmolytic action and expectorant action. So
hmm,
what is mucolytic action? It indirectly increases the beta 2 adrenergic effect, causing
hmm,
increase in the surfactant production, and
hmm,
mucus viscosity is reduced, leading to
hmm,
mucolysis and reduced coughing.
hmm,
Then what is bronchospasmolytic action?
hmm,
Here it intervenes the down regulation of beta 2 receptor by preventing the actually endocytosis of the beta 2 receptor, and the
hmm,
actually bronchodilating effect of adrenaline is indirectly intensified. So that's how bronchospasmolytic effect is working, and expectorant action where it acts indirectly via the beta 2 adrenergic system, resulting in the bronchospasmolytic and mucolysis, and liquefaction of the mucus helps to cough more productively and less frequently. So this triple action formula definitely helps. Then additional pharmacological benefit can be actually here antibiotics and antimicrobial activity is also there, where activity against several microorganisms, gram positive and gram negative bacteria, yeast or fungi and parasites. Then anti-inflammatory property, where it inhibits actually NF beta transcriptional activity, and there is also hepatoprotective aspects are also there, which reduces hepatotoxicity of several agents and which are metabolized by the cytochrome P450 oxidase. So that's how actually ivy leaf dry extract is an expectorant containing dry ivy leaf extract, and it works by thinning and loosening phlegm or mucus in the lungs, windpipe, and nasal passage, thereby helping to cough out easily. It soothes the airway as well as. Uh, ivy leaf is an evergreen plant actually that offers some surprising benefit. As a house plant, it may help to purify the air. When ingested, some research suggests that it may provide antioxidant and anti-inflammatory benefit. And in addition, it appears to be useful in reducing cough related to cold and viral infection.
So, sir, since you mentioned about in productive cough the treatment and agreed that Prospan has multiple benefits of mucolytic, bronchospasmolytic, along with that the antimicrobiological properties and the anti-inflammatory properties. So, here can you also mention that does the ivy leaf extract cough syrup reduce other symptoms of respiratory tract infections?
Yes, definitely. Actually, there is fourfold power of ivy leaf. So that is one is bronchodilatory, then is anti-inflammatory, then secretolytic, as well as cough relieving. So all
Hmm,
these four properties actually there is a competitive advantage of uniqueness, tolerability, and efficacy. So
hmm,
it is very important that these Prospan definitely helps us in reducing the cough. And actually, clinical data also suggests that it can be used in acute cough in children, acute cough in adult, acute bronchitis in adult, acute
hmm,
bronchitis in actually school-age children, chronic bronchitis in adult, then childhood bronchitis, asthma, then children with respiratory tract disease, and acute or chronic inflammatory bronchial diseases also. So actually, it Ivy leaf extract preparation have effect with the respect to an improvement in respiratory function of children with the chronic bronchial asthma. So that's why the lung capacity also increases, and it is safe for use in cough due to acute URTI as well as bronchitis.
So, sir rightly mentioned that there is a lot of benefits and in multiple indications that Prospan has worked effectively, and also that it is very effective in children. So, sir, highlighting that part, what is exactly the effectiveness of ivy leaf extract cough syrup in children for productive cough specifically?
Actually, there are many randomized, controlled, double-blind, multicentric trials has been evaluated about the efficacy and safety of Prospan versus placebo, and here we have seen that definitely it is a helpful. Many trials are there. So, where diagnosis of acute cough with symptoms lasting for 2 to 3 days, and 7 days treatment or 14 days treatment. So actually, Prospan has a rapid onset of action and already achieves a statistically significant reduction in the cough severity within 48 hours. So cough severity is reduced in 48 hours compared to other placebo. Then positive effect persists and it reduces the patient's subjectively perceived cough severity in median up to 1 week faster than placebo. So confirmation of very good efficacy and very good tolerability in sorry, adult patient suffering from acute cough. It is rated to have better efficacy and very well tolerated in the global efficacy assessment in 2019. So effectiveness of Ivy leaf extract cough syrup as compared to other available cough syrup for treating productive cough in the children is also very important.
Yes, yes. So, sir, rightly, mentioned by you that it is highly effective in treating productive cough in children. So, sir, now that we also previously discussed about the available, options, therapeutic options, and there are multiple commercially available cough syrups also, but they have their own disadvantages. So, here, as compared to the commercially available cough syrup, how is the effectiveness of dry leaf extract in treatment of productive cough in children?
Yeah, actually, there is open label, multi-centered, and post marketing, including 9,657 patients diagnosed with bronchitis for children between age to 0 to 14 years was conducted. And here the study dosage or duration of for the 7 days has been given. So for 0 to 5 years, 2.5 ml 3 times a day, or for 6 to 12 years, 5 ml 3 times a day. For 12 years upward, 5 to 7.5 ml 3 times a day. So the results which shows that symptoms were improved or cured in 95.1% of all patients after 7 days of treatment, with improvement in or curing the cough in 93.4% and expectorate on 92.9%, dyspnea in 91.2%, and pain in 90.8% of all patients. So that is very important figures which suggest that how this medicine is very useful. And physician rated the tolerability in 96.6% of all patients as very good or good. So 96.6% patients also tolerate it very well. The separate assessment of patients receiving concomitant actually medication revealed that additional administration of an antibiotic did not improve the efficacy of treatment. Instead, the relative risk of undesirable effects rose. So that's why actually it is not necessary to add the antibiotic also. It has a very good antibiotic effect also. So that is very important, and I think such medicine which very good tolerability as well as improvement in cough and dyspnea and expectorant and pain is definitely a very useful thing. So actually from the study which was conducted, the administration of Antibiotic in case of bronchitis has no additional effect, which is due to the fact that almost all cases of bronchitis were caused by viruses. And IV leaf dry extract is effective for bronchitis patients of all age group.
Hmm, hmm, hmm. Yes, so sir, this is actually a wonderful, pointer to share that not just productive cough, but also the other associated symptoms like dyspnea, chest pain, and
Yeah.
expectoration is all, taken care by Prospan. So, and also that in children that it is showing such great effectiveness.
Yes,
So, sir,
and even proper doses of children has been also calculated. So it is
hmm,
not that the trials shows that proper dosing of the medicine, how it is
hmm.
useful.
Hmm.
Yeah.
Yes, so sir, just I was going to ask you about, that how important is dosing in IV leaf extract cough syrup when prescribed to children?
Yeah, I think I've told you in the last
Hmm.
actually answer only that
Hmm.
dosage is very important, and
Hmm.
if you actually want to calculate the dose properly, so it
Hmm.
should be 2.5 ml or 1 teaspoonful 3 times a day for 2 to 5 years.
Hmm.
Below 2 years, this medicine should not be used. That it should be actually keep in mind. 5 to 2 years, 12 years, 2 teaspoonful or 5 ml 3 times a day. More than 12 years, 7.5 ml 3 times a day. So that should be the dosage.
Hmm. Hmm. So, sir, actually, there are studies that that show that it is showing the safety in children in less than 1 year also. So that those studies are also available. So here, sir, I would also like to understand that how safe is IV leaf extract in children.
Yeah, actually, here there are some studies which suggest that tolerability of the treatment with
Hmm.
Prospan cough syrup is extreme in extremely large group. Actually,
Hmm.
a retrospective survey was conducted to
Hmm.
document tolerability of the treatment with Prospan cough syrup in an
Hmm.
extremely large group of children. So,
Hmm. Hmm.
52,478 children aged
Hmm.
from 0
Hmm.
to 12 years.
Hmm.
Actually,
Hmm.
in that 8,071 were below 1 year,
Hmm.
26,566 age 1 to 5 years,
Hmm.
13,046 from age to 6 to 9 years, and 4,795 from 10 to 12 years.
Hmm.
Here, diagnosis was symptomatic respiratory tract disease. And then the committee of herbal medicinal products recognized by IV leaf extract as a possible treatment for the conditions as well as cough. The people should only give it to the toddlers over the age of 2. That is their recommendation at present. But in this trial, below 1 year also we have there were children and it was found safe. Cough medication can worsen actually breathing symptoms uh, that has been told if it is used in proper doses. So, in conclusion, IV leaf extract in the form of syrup as well as cough droplet was cough drops was confirmed as effective and safe treatment of cough in children. So,
Yes, yes.
actually, to summarize the benefit, what we can say that it is a secretolytic which liquefies mucus, anti-inflammatory which alleviates the inflammation, bronchodilatory that is supports unobstructive breathing, then cough relieving through the anti-inflammatory as well as serolytic and bronchospasmolytic action. Then high evidence actually has been their recommendation by the German guidelines also. This has been said that this medicine, how it is useful and indicated for acute as well as chronic airway diseases, and also applicable for the actually pollen allergies also. So that is the benefits which we can say about this medicine, Praspon.
Right, right, sir. So correctly, yes, very wonderfully explained by you that there is a lot of data regarding the safety in children, and that it has multiple benefits. It just does not alleviate symptoms of productive cough, but it also reduces other symptoms of other diseases like bronchitis and asthma. So, sir, final message to the viewers that you would like to give
Yes.
on prospanol.
Definitely. Actually, here what I will like to say the viewers is that for the productive cough in children also, it is very safe drug. The tolerability is also good, and it has a very good action of mucolytic action as well as actually bronchodilator action is also there, and
Hmm.
it is a very good drug which can be used very safely and with the dosage of 2.5 ml, 5 ml and 7.5 ml according to the age. And if you can use it, it will definitely be useful for your patients.
Thank you, sir, for sharing such great insights. And it is a learning experience for me, and I'm sure that the viewers also now understand how important the role of dry leaf cough extract cough syrup is in productive cough, and how it alleviates other symptoms of major respiratory indications. So, thank you
Yes,
so much, sir, for sharing
yes,
your insights and experience.
yes.
Thank you.
Thank you very much. Are there any questions from the audience?
Sir, there was one question on dosage which we already,
Yeah.
spoke on.
Okay,
Yeah.
okay, okay. That's
Thank you.
thank you
Thank you,
very
sir.
much. Thank you very much. Thanks a lot.